Welcome back to the channel. You may have heard of the medicine Gabapentin. It's commonly used for nerve pain and for certain kinds of seizures. But what many people don't know is that gabapentin can cause several side effects that often go unnoticed. In this video, we're going to break down 10 important side effects you should be aware of what they feel like, and when it might be time to talk to a doctor. So if you or someone you know is taking gabapentin, stay with me. Let's dive in. Gabapentin, a prescription medicine that was first approved to treat partial seizures. According to the Cleveland Clinic, it works by calming down overactive nerves in the brain. Over the years, doctors also began using it for several other conditions, especially neuropathic pain, which includes burning, tingling, or shooting nerve pain. Research published in Dove Medical Press also notes that gabapentin is used for problems like restless leg syndrome, nerve pain from diabetes, shingles, and even some types of chronic pain. Like every medication, it can be very helpful, but it also comes with possible risks and side effects that everyone should understand before using it. Side effect number 1, dizziness and drowsiness. One of the first things many people notice after starting gabapentin is a sudden feeling of heaviness in the head. It can make you feel sleepy even when you're not tired, and for some people, it feels like the room is slightly moving. This dizziness can come and go, or it may stay with you for several hours after taking the dose. Some users say they feel off balance, like their steps are not fully under their control. This happens because gabapentin slows down nerve activity inside the brain, and this affects your sense of stability and coordination. You might feel drunk without drinking anything. That's why doctors warn people not to drive, cook with hot oil, or handle machinery until they know exactly how their body reacts. The danger isn't the dizziness itself, it's what can happen because of it, like falls, slips, or sudden loss of control in daily activities. Side effect number 2, blurred vision and eye coordination issues. Another surprising side effect of gabapentin involves your eyesight. Many users report that their vision suddenly becomes blurry or that they struggle to focus on words, screens, or distant objects. Some even describe seeing double for a few moments, as if their eyes are not moving together. This can be uncomfortable and alarming, especially if it happens suddenly. These vision issues occur because gabapentin affects the central nervous system, and your eyes are directly connected to those signals. When nerve communication slows down, your eye coordination can become delayed or uneven. For some people, reading becomes difficult, and bright lights may feel harsh. If these effects are mild, they usually fade with time. But if you notice extreme blurring, strange eye movements, or if your sight changes all at once, it's important to contact a medical professional. Vision problems can be one of the more unsettling side effects people experience with gabapentin. Side effect 3, weight gain and swelling, peripheral edema. Weight gain. While taking gabapentin can feel confusing because it often happens even when your eating habits haven't changed. Some people notice that within a few weeks their clothes start feeling tighter, or their face looks puffier in the mirror. Others see swelling in their hands, feet, or ankles. This is known as peripheral edema. This swelling happens when extra fluid gets trapped in the body, and gabapentin can slow your body's natural fluid movement. For some people, this leads to noticeable water retention and gradual weight gain. It can feel discouraging, especially if you are trying to manage your weight or already deal with health issues. Keeping an eye on your weight, checking for swelling, and noticing when your shoes feel tighter can help you catch this side effect early. If the swelling becomes painful or rapid, it's important to talk to your doctor to adjust the dose or explore safer alternatives. Side effect number 4, cognitive memory problems. And confusion. One of the more troubling effects some people experience is a foggy or slowed down feeling in the mind. You might forget simple things or struggle to find the right words during a conversation. Tasks that normally feel easy, like following a recipe or writing an email, can suddenly feel more difficult. This mental fog happens because gabapentin affects how your brain processes information and sends signals. Some studies raise concerns that long-term use may increase the chances of memory decline or slow cognitive thinking. Many users describe feeling disconnected or mentally slower than usual. It's not about intelligence. It's about how quickly your brain can respond. If you start noticing mood changes, confusion, or a strange emotional numbness, it's important to pay attention. These symptoms can build up quietly. Talking to doctor early can help prevent long-term issues and may even allow you to switch to a safer option. Side effect number 5, mood changes and suicidal thoughts. Gabapentin doesn't only affect the body, it can also affect the mind. Some people start to feel irritated more easily, or they notice sudden mood swings without any clear reason. What makes this side effect more serious is that, in rare cases, gabapentin has been linked to increased depression or even suicidal thoughts. This can be shocking because most people take gabapentin for pain relief, not realizing it may influence their emotional balance. The medicine slows nerve activity, and this can disrupt natural brain chemicals that help control mood. If someone starts feeling hopeless, overly anxious, unusually angry, or emotionally unstable, these changes should not be ignored. This isn't just about feeling low. It can be a warning sign that the medication is affecting deeper mental pathways. Anyone who notices these shifts or sees them in a loved one should seek help immediately. Mental health changes are one of the most serious risks of gabapentin. Side effect number 6, respiratory, breathing problems. One of the most dangerous but often overlooked side effects of gabapentin is its effect on breathing. On its own, it can make your breath slower and shallower. But the real danger appears when it's taken with other medications, like opioids, sleeping pills, or anti-anxiety drugs. When mixed, these medicines can suppress the nervous system to the point where breathing becomes dangerously slow. People with lung problems such as COPD or asthma face an even higher risk. Some users describe feeling unusually tired, weak, or short of breath, as if their chest feels heavy. These symptoms can sneak up on you because they develop slowly, not suddenly. If you start feeling unusually drowsy or notice your breathing is slower, it's important to take it seriously. Breathing issues are nothing to ignore. They can be life-threatening. Always talk to a doctor if you're on other sedating medications or have any respiratory conditions before using gabapentin. Side effect number 7, ataxia and coordination problems. Gabapentin can also affect your body's balance and coordination, leading to a condition known as ataxia. At first, it might feel like small, clumsy moments, knocking things over, stumbling slightly, or having trouble walking in a straight line. Over time, these symptoms can become more noticeable. This happens because gabapentin interferes with the communication between your nerves and muscles, which are responsible for smooth, controlled movements. Some people describe a strange disconnect, as if their legs aren't doing exactly what their brain tells them. For older adults, this side effect can be especially dangerous because it increases the risk of falls. Simple tasks like climbing stairs, carrying items, or walking on uneven surfaces can become difficult. If you notice these changes, it's important to slow down, use handrails, and take extra care. Persistent or worsening issues should be discussed with a doctor to avoid injuries and explore safer options. Side effect number 8, digestive issues. Gabapentin can upset the stomach in several ways. Some people feel nauseous shortly after taking it, like their stomach is turning. Others experience vomiting, especially during the first few days of treatment. Digestive changes may also include constipation or diarrhea, making your daily routine uncomfortable. These symptoms occur because gabapentin interacts with the nervous system, which also controls the digestive tract. When those signals slow down or get disrupted, your stomach and intestines react. For some people, these issues are mild and temporary. For others, they can become bothersome and persistent. It's important to stay hydrated, especially if vomiting or diarrhea occurs, because dehydration can make you feel even worse. Eating smaller meals or taking the medicine with food may help, but if the stomach problems continue or become severe, a doctor should be consulted. Digestive discomfort may seem minor, but it can significantly affect quality of life. Side effect number 9: tremors, eye movement problems, and myoclonus. While rare, some users experience unusual movements in the body after taking gabapentin. Tremors, shaky or trembling hands, are one common complaint. Others report jerky, sudden muscle movements known as myoclonus. The C can happen at random times, even when you're resting. Eye movement problems can also appear, where the eyes move in odd or uncontrollable ways, making it harder to focus or read. These effects happen because gabapentin affects how nerve signals travel through the body. When those signals become unsteady, your muscles and eyes may behave unpredictably. Although these symptoms are not common, they can be alarming when they appear. They may interfere with simple activities like writing, using a phone, or holding objects steadily. If you notice tremors or strange muscle jerks that don't go away, it's important to get medical advice. Sometimes adjusting the dose or switching medication can completely resolve the problem. SID effect number 10: dependency, withdrawal and hospitalization risk. Even though gabapentin isn't classed as a strong addictive drug, the body can still become dependent on it. This means that stopping it suddenly can cause withdrawal symptoms such as anxiety, sweating, nausea, restlessness, or even seizures, especially for people taking higher doses. This is why doctors always recommend tapering the dose slowly rather than quitting overnight. Some studies have also shown that people using gabapentin, especially long-term, may have a higher chance of hospitalization due to side effects, breathing problems, or dangerous drug interactions. This doesn't mean everyone will experience it, but it highlights the importance of careful monitoring. Many people assume gabapentin is harmless because it's widely prescribed, but the truth is that it works on the brain and nerves, so stopping it without guidance can be risky. Anyone planning to reduce or discontinue gabapentin should always do so under medical supervision to avoid serious complications. Gabapentin can be a helpful medication for nerve pain and seizures, but it comes with a wide range of side effects from dizziness and blurred vision to mood changes, breathing problems, memory issues, and withdrawal risks. Understanding these effects doesn't mean the medicine is bad, but it does mean you should stay informed and pay attention to how your body reacts. If you notice new or worsening symptoms, don't ignore them. Avoid mixing gabapentin with alcohol or other sedative medications unless your doctor approves. Never stop the medicine suddenly, because withdrawal can be dangerous. If you ever experience severe reactions like difficulty breathing, extreme mood changes, suicidal thoughts, or sudden swelling, seek medical help right away. Your safety always comes first. Staying aware, asking questions, and being cautious with your dosage can help you use gabapentin more safely and confidently.